Hello everyone, Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsborough with Technique Tuesday, and we're doing a theme of videos, or a series of videos on hip pain or sacroiliac joint pain. This exercise, the series of exercises can work for either of those conditions, okay? Alright, so in previous video, I'd done that we're doing repeated hip extension and half kneeling. So we've done the hip extension with overpressure. I find that works for the vast majority of people. If you didn't respond, well, if it made you worse, don't do it. If it made you a lot better, keep doing it. If it made you kind of better, but you're needing a little more, then you might give this alternative a try. This is a force alternative. So we're going to do the same thing. We're going to do repeated hip extension with that overpressure in the back hand, but we're going to do a hold at the end. So we're going to do a sustained position or sustained hold at the end. So again, the painful side is down. We are next to a surface to support us for balance and to help us get into end range. So remember, it is an end range technique. You're going to do 10 to 15 of these repeated hip extensions with the overpressure. On the last repetition, you're actually, okay, here I go. Pressure on, pressure off, pressure on, getting farther and farther each time. On that 15th rep, you're actually going to hold for 15 to 30 seconds. I would do this. I won't do the whole thing. We'll do time-lapse photography like they do in National Geographic. But I'd go for 30 seconds, 15 to 30 seconds. So if you were doing the one with overpressure, it was kind of working, but it wasn't quite getting it all the way gone, or it's kind of plateaued, then give this sustained one a try. And this tends to work for those folks. So again, front foot is kicked out far, supported surface here, painful side knee is down, hand on the upper part of the buttock, the GQ pose, and we're going pressure on, pressure off, pressure on, pressure off. 10 to 15 reps on that last rep. Hold 15 to 30 seconds. Whatever you're having difficulty or pain with, whether it be sitting, squatting, or getting that knee pulled up really high to your chest, retest those things to see that they are better. And if they are better, that's a green light. Go for it. If they're worse, that's probably a red light and I wouldn't do it. Okay? All right. Like us on Facebook, like the video, leave comments below. Check with your physical therapist or physician before doing any of these to make sure they're appropriate for you. Dr. Sam Schroetke here, Physical Therapy and Hand Clinic, Hillsborough.